Right, focusing on the genital or reproductive system infections. So looking first at females, so vaginitis or vaginititis, so some of the signs and symptoms, of course, inflammation of the vagina, usually some type of vaginal itching, burning, and or discharge, typically caused by a yeast infection, which is Candida albicans or Trichomonas. Looking first at Candida albicans, this is one of our fungal infections, so it's dimorphic, so it can exist either as a single-celled organism or multicellular. It is part of our normal biota, but again can become kind of able to cause an infection when the other bacteria, like during treatment with an antibiotic, occurs, so they are able to kind of overproduce for some reason. It is easily detectable by looking at a wet prep. Kind of grows in curd-like colonies on the wall. It is, again, typically opportunistic, meaning something has to hinder the other normal biota in order for it to cause an infection. And then it can be treated with topical or oral azole drugs that can treat those fungal infections. Then the Trichomonas vaginalis, so this is caused by a protozoa. Typically it's asymptomatic. Again, we don't even really classify it as men because they seldom have any symptoms. In females, though, it can cause a green, frothy discharge. Women typically become infected during pregnancy, and they're predisposed to a premature labor and low birth weight in infants. It's one of the most common non-viral sexually transmitted diseases or infections. Again, most of them are viral, but as far as the non-viral, this is the most common outside of those viruses. It is treated by a drug called metronidazole that would then inhibit that protist. So the vaginitis, again, summary here. So our yeast, the Candida albicans, again, it is opportunistic. It's already in the genital tract, but has some ability to overproduce. Again, topical azole drugs that can actually be found over the counter. That white curd-like discharge gives it its distinctive features. And then the Trichomonas vaginalis, direct contact, again, it is a sexually transmitted disease or infection. It is a protist that can be detected, so providing a barrier, of course, safe sex, but it can be treated by metronidazole. Again, most common infection other than virus, besides viral STIs. Right now, vaginosis. This is a common condition, again, in childbearing years. This does not induce inflammation. So we have vaginititis that does cause inflammation of the vagina. Vaginosis is a disease or an infection of the vagina without inflammation. Again, produces a discharge that has kind of a fishy odor and causes itching as well. Most likely due to a reduction in those lactobacilli that are common in the normal biota of the vagina. Can be caused by a mixture of organisms, so that Gardnerella, I really struggled that one, Apoptobium, and the Mobiluncus. It can lead to PID, infertility, or ectopic pregnancy. So again, mainly an issue resulting in pregnancy. It is not sexually transmitted, but can be more common in sexually active women. So it's not caused by that, but sex itself can increase its ability to cause an infection. Just kind of looking at this. So again, we have our normal vaginal cells here, and then this is the epithelium that has all of these bacteria. So all these little blue indicating those bacterial, the presence of bacteria. Again, this is caused by mixed infection, so multiple causative agents here. Again, is opportunistic. Again, can increase during sexual intercourse, but mainly due to opportunism. Again, can be treated with a couple different drugs, metronidazole or clindamycin. Again, the main distinctive feature is that fishy smell in the discharge. Right, prostatitis, so this would be inflammation of the prostate. So here in males, of course, this can either be acute or chronic. So short term, almost always caused by bacteria from the normal biota of the GI. So they're able to escape and cause an infection in the prostate. Chronic, though, also caused by bacteria, unfortunately, typically unresponsive to antibiotics that allows them to persist, and is caused by a mixed biofilm that occurs in the prostate. Some of the signs and symptoms, so pain in the groin and lower back, frequent urge to urinate, difficulty urinating, so blood in the urine, and painful ejaculation. All right, our summary slide, again, caused by normal biota that are in the GI tract that are able to then infect the prostate, caused by a mixture of organisms. It's endogenous, again, transfer, various virulence factors depending on which ones we're actually looking at. No way to really prevent it. Antibiotics are used to treat it, but also muscle relaxers and alpha blockers can be given mainly to help with symptoms. And then that distinctive characteristic that sets it apart is the pain in the genital and or the back and the difficulty urinating. Moving on to gonorrhea. So in males, it causes erythritis, so infection of the or inflammation of the urethra, painful urination, yellowish discharge, but a lot of times it is asymptomatic. In females, it causes this mucopurulent or bloody vaginal discharge, as well as painful urination. Salpingitis is inflammation of the fallopian tubes that can occur due to gonorrhea, and it can also cause PID, which is that pelvic inflammatory disease. Also, it can have vertical or dissemination from a mom with gonorrhea can pass it on to the child. So child born to those carriers can be infected as they go through the birth canal. So again, the mom may not actually have an active infection, but they can be carriers, so they can contain those organisms. So during passage through the canal can lead to gonococcal eye infections that can result in blindness. All right, this invasive gonorrhea here in women that we're seeing, so again, it's able to infect the fallopian tubes. So here's kind of our normal fallopian tubes. In gonorrhea, though, that's going to become inflamed and infected, so that can then pass on and lead to scar tissue that can lead to an ectopic pregnancy because the infant isn't able to get established into the uterus. Right, then looking at the neonatal infection, so this is what it would look like. So again, if they were, the infant picked up this species on its way through the birth canal. All right, looking at this causative agent, so it is a diplococcus, it's gram-negative, so again, two of them kind of clumped together. They do have fimbriae that help them attach to the epithelial mucus layer. They have phase variation that confuses the immune system, so it doesn't quite know what to do with it depending on which phase it's in. Again, transmitted by sexual contact. And then infection increases actually the risk of developing an HIV infection. So somebody who's had gonorrhea is more likely to get an HIV infection when exposed than someone who has not had gonorrhea before. And then some are becoming resistant to antibiotics as well. All right, chlamydia, moving on to that. This is actually the most common reportable infectious disease in the United States. So very prevalent in males, discharge and painful urination, kind of a reoccurring theme that we see with these STIs and other genital infections in females, infection or inflammation of the cervix, again, also discharge, the salpingitis, and the pelvic inflammatory disease. But as mentioned here, about 75% or the majority are actually asymptomatic, which increases the ability to spread because individuals can have this and not have any symptoms. Also, it is able to cause lymphogranuloma, which is where it can invade the lymphatic tissue. That leads to headache, fever, and muscle aches. All right, this organism, Chlamydia trachomatis, is a small gram-negative bacteria. It is an obligate intracellular parasite, so it cannot reproduce outside of the host. The cell wall prevents phagosome-lysosome fusion. So if you remember from our immune system, phagocytes, like our macrophages, engulf the bacteria and then fuse to a lysosome that degrades it. Well, this organism binds to a phagocyte, but then doesn't get degraded by the lysosome. So it's able to survive and kind of hide within the cells. Again, broad distribution. Antibiotics can be used, doxycycline and zithromycin. So co-infection is also really common with gonorrhea. Just kind of looking at the prevalence of this and in the different age groups. So of course, most prevalent in young adults, again, due to its sexually transmitted nature. Okay, so kind of our summary table here, looking at the genital discharge diseases. So again, all of these lead to some type of discharge. Neisseria, gonorrhea, again, STI, also vertical though, can be passed from mom to infant. Some of the virulence factors is fimbriae that help it attach, antigenic variation that kind of messes with the immune system's ability to detect it, has IgA protease, so it breaks down or inhibits those antibodies. And then it can also has an endotoxin that is released. Again, prevention would be condom use or avoiding contact. Treatment is available, but co-infection with gonorrhea should be assumed and then treated with a combination of ceftriaxone and azithromycin. Antibiotic resistant strains, though, are on that urgent threat list from the CDC. Some of the distinctive characteristics, rare, but sometimes possible complications are arthritis, meningitis, and endocarditis, or infection of the heart. Whereas in the fetus, again, it can lead to those eye infections that can result in blindness. Then the chlamydia trachomatis, again, STI, direct contact, or again, vertical from mom to infant if the mom's infected. It has this intracellular growth, so it can go in, it avoids being destroyed by the lysosome, so it essentially avoids the immune system. It can release cytokines. It has this really weird, again, cell wall that prevents that fusion. So again, avoiding contact or condom use. Again, co-infection by chlamydia and gonorrhea should be assumed, so we get that combination treatment. And this is more commonly asymptomatic than gonorrhea, so that's why typically we assume, or it's assumed, that both are present. And again, also, this can cause eye infections and pneumonia in the fetus. All right, now syphilis, this was actually recognized early in the 15th century, so there's kind of a lot of kind of history that's unique if you're kind of interested in all of that. And so unfortunately, some very unethical studies that were done in Negro males in the early 30s. Some of the signs and symptoms, so primary syphilis occurs that leads to what are called chancres, which are small red kind of hard bumps that appear at the site of entry. They appear on the external and internal genitalia, can be on the lips, oral cavity, nipples, fingers, and even around the anus. Then secondary syphilis occurs where we get fever, headache, and sore throats, lymphadenopathy. We get red and brown rash on the skin, like the palms of the hands, soles of feet, and even some hair loss that can occur during that secondary stage. Then the late or tertiary syphilis, if it progresses as far, this is where it gets much more serious. So it can damage the small arteries and aortic wall that can lead to cardiac problems. They can produce gumas that develop the liver, skin, bone, and cartilage. It can invade the nervous system. So whenever we went through the nervous diseases, we kind of mentioned it and said we'd be back. We're back. So it does infect the nervous system in that tertiary stage that leads to headaches, convulsions, atrophy of the optic nerves, which can then lead to blindness, dementia, and Argyll-Robertson pupil. So it can affect the eye. And then we can also have congenital syphilis, so in the infant. So it inhibits fetal growth and disrupts critical periods of development and causes abnormalities and spontaneous miscarriages and stillbirth. Just kind of looking at the different stages. Again, here's one of those chancres that can occur secondary, and then we get the gumas later on, which is what we're starting to see. Then the congenital syphilis, again, it's poor little baby. So those signs and symptoms that can occur during that vertical transmission to the infant. All right, looking next at our Tryponium pallidum, this is what is causing syphilis. So it is a gram-negative bacteria. It has that cell wall. The epithelial cell it binds using this hooked tip. So it's a unique looking cell. That outer membrane, because it's gram-negative, has the lipoproteins on it that cause an immune response or an inflammation to occur. Again, barriers do provide protection to prevent this. Again, just kind of looking at some of the incidence rates of total syphilis have unfortunately been increasing over the years. All right, next we have the chancroids. So Haemophilus duceri. This is a pleomorphic, meaning it have multiple shapes. Gram-negative rod gets its name because it forms soft chancres, which are painful in men, but often unnoticeable in women. Typical in the tropics and subtropics. Again, sexually transmitted here, so associated with sex workers and poor hygiene. Also, uncircumcised men are more commonly infected, and it can be treated by that is azithromycin and ceftriaxone. Genital herpes caused by herpes simplex 1 or 2, so cold sores versus genital herpes. So the signs and symptoms, so single or multiple vesicles on the genitalia, again similar to the cold sore on the mouth. Vesicles are filled with those clear fluid, intensely painful whenever they're touched. Again, this one can become latent, so we get recurrent episodes because they can become dormant in the ganglia. It is possible, but to cause encephalitis. So again, this one was mentioned with our nervous system diseases as well. Neonatal herpes simplex, again, that dissemination, vertical transfer from mom to infant. These infections typically of the mouth, skin, and the eyes has about a 30% mortality rate. Does infect the central nervous system in the neonates to cause a lot of mortality. So any evidence of this outbreak at the time of delivery would result in a cesarean to prevent passage through the birth canal. All right, so if we look at the herpes simplex virus 1 and 2. They're both DNA viruses. They both can become latent, so that reactivation can occur because they're able to go through the ganglion. Stress, UV radiation, injury, menstruation, other infections are all known to trigger or reactivate them. Transmission is through direct exposure to secretions of the virus, can be treated with acyclovir and derivatives. That just helps to reduce the viral shedding, which is the release of virions from our cells that occur at those lesions, but it is not curative. It does not remove the virus from the body. So just looking at how, again, this latent version happens. So again, if we think about the skin, so the lesions here that are caused by the HSV, again, those viruses are able to travel up the neuron to the ganglion, which is just a group of cell bodies from the neurons, and then they just become dormant here. And then just as they went up, they can also then come back down and then cause new lesions at different times. What these look like kind of in a pap smear, so we'll see these inclusion bodies, again, kind of some normal cells over here, but then these giant cells with multiple nuclei that are due to the presence of that virus. So looking at some of these ulcer diseases, so again, we have discharge diseases, we have ulcer diseases, so syphilis caused by the trypanemia pallidum, again, direct contact or vertical from mom to infant. They're gram-negative, so they have the lipoproteins. Can be treated with penicillin, and of course, avoiding contact is important. Chancroid disease caused by the Haemophilus duceri, direct contact or vertical, but vertical in this case has not been documented, so mom to infant has not been shown. So they produce these chancres due to the presence of hemolysin or exotoxin that's produced. So avoiding contact, but then also treating with antibiotics. So the herpes caused by a virus instead of bacteria. So direct contact, again, there is vertical transmission that's possible. It can become latent by moving up to those ganglion. So avoiding contact, again, antivirals can reduce the occurrence. It doesn't cure it, but the acyclovir can reduce that shedding. Also, just some of the distinctive features. In syphilis, again, we have the 3 stages that occur. There's also a latent period. We can get congenital syphilis that occurs with the chancroids. No systemic effects, just the chancres that appear. And then with the herpes, again, it ranges from asymptomatic to frequent reoccurrences in infants. When it's passed vertically or by the dissemination, we can get blindness or a herpes infection in the infant. All right, then human papillomaviruses or HPV. We talked about the skin diseases, but there are also some that cause genital warts to occur. So in females, these growths can occur on the vulva, in and around the vagina, as well as just have a silent infection in the cervix that doesn't actually produce a wart-like structure. And then in males, the warts appear on the penis and the scrotum. Now in both males and females, the warts can be on or in the anus, also skin around the groin, the thigh, and the pelvis. And then condyloma acuminata, this is the branching kind of flower-like mass that they produce. Now there is a link between, especially the cervical, so individuals that have the wart-like visual structures, those are not linked to cancer, but the strains of HPV that cause the cervical infections or infect the cervix, those are linked to to causing cervical cancer. And about 4,000 women die each year from cervical cancer caused by HPV. There's also a link between oral activity and increased risk of throat cancer, so that it can be through oral sex also established and can lead to throat cancer. And then males can get genitourinary tract cancer from HPV, so it can cause cancer in both males and females. Again, but there are multiple strains of the virus, and each may or may not be linked to cancer. Some of the other information about these, again, it's caused by an unenveloped DNA virus. Again, multiple strains, but the strains 16 and 18 are the ones linked to cervical cancer. Again, transmission epidemiology listed there as well. So preventing is by avoiding direct or unprotected sexual contact. There is a new vaccination, relatively new vaccine that's available called Gardasil. This protects against the two most common strains, so that's 16 and 18, that are linked to cervical cancer. Now, it does not prevent against the other types of cancer or the other types of HPV that could lead to warts, but the idea is to decrease the incidence of cancer due to HPV. Those can cause warts as well, but again, which can cause the remaining cases of cervical cancer. Even vaccinated women should still get Pap smears and screenings for cervical cancer because it can develop from other issues other than HPV. So there are multiple things that can cause cervical cancer. So being vaccinated doesn't eliminate the need for regular Pap smears. And then just again, recently in 2019, the CDC did recommend vaccination to include men up to the age of 26. So these HPV-caused cancers of male oral activity, the anus and the penis, are common. Right. The molluscum here we mentioned before with our skin infections, but this is caused by an unclassified virus of the Poxviridae family. Again, causes wart-like growths to occur on the mucous membranes of the skin, but also the skin around the genital area. So we talk about it here and with the skin diseases. Typically more serious and immunocompromised, transmitted through fomites, so or inanimate objects like doorknobs and that type of thing, but also auto-inoculation. Right, so then our wart diseases that are here, we have the HPV, the human papillomavirus, and the molluscum caused by the poxvirus. So both viral infections that lead to the warts, both can be caused by STI, sexually transmitted, but with HPV and the molluscum, we get indirect contact or auto-inoculation. Some of the virulence factors of HPV, those are those oncogenes that can lead to the development of cancer. We do not see that with the molluscum. Prevention, there is a vaccine against some of the HPV viruses, as well as screening the cervix for cancer. Again, just avoiding direct contact for both. As far as treatment, the warts can be removed, but the virus is not treatable. So again, it's not a cure, it's just treating the symptoms. Same with the molluscum, those warts can be removed, but the virus cannot be completely eradicated. Just some of the distinguishing features here. So the infection, again, may or may not cause warts. Again, cervical cancer is caused by infection, HPV in the cervix, but there are no warts that are necessarily generated. In the effect on the fetus, warts can occur essentially in the throat, so the laryngeal warts can occur. With the molluscum, the wart-like growth are a known consequence, our only known consequence of the infection. So it's not like cervical cancer or anything. It is just the wart. All right, we also have this strep B, Streptococcus colonization. So this is only in neonates. So about 10 to 40% of women have this beta hemolytic Streptococcus in the Lancefield group B, just the classification of it. So again, the issue is during delivery. So the infant can become colonized during passage through the canal. Unfortunately for the infant, it is life-threatening infection that causes the infection of the blood, can also lead to meningitis or pneumonia. So the CDC recommends screening of all pregnant women around 35 to 37 weeks before pregnancy, and then if it is found to be present and to be treated then with antibiotics to decrease the chance of transmitting it to the infant. So again, caused by strep B or group B, Streptococcus. Again, it's vertical transmission from an infected mom or someone, a carrier of the mom to the infant. So treating the mother is how this is actually treated. Again, just looking overall at some of the sexually transmitted disease, the most common sexually transmitted as far as especially is our virus, which is HPV. So this is the prevalence. So how prevalent it is. Incidence, of course, are like the new cases. Then herpes, followed by that. Again, then the trick, chlamydia, HIV, gonorrhea, syphilis, and then the HBV with the lowest incidence. All right, and then just our last couple slides here, looking at the taxonomy. So a couple gram-positive bacteria. So the urinary tract infection caused by that staph, or the group B strep that we just talked about with the neonatal disease. Quite a few gram-negative bacteria that lead to the urinary tract infections, leptospirosis, gonorrhea, chlamydia, syphilis, and the chancroid disease. And then quite a few viruses, so herpes, HPV, and the pox virus that lead to herpes, warts, and the molluscum contagiosum. Then our only fungus would be vaginitis caused by that yeast infection, the Candida albicans, the trick caused one of the protozoans, and then the helminthschistosoma that leads to that urinary schistosomiasis.